The next class, class number 19, extremely important, leukemia and introduction. Oh my God, for the exam. It is an alarming topic. Let us see how much we can simplify it. I will be taking it in phases. So these are the cells that we people should remember. The myeloblast, a large cell, it has got a large nucleus, multiple nucleoli, the pale areas. Promyelocyte, it can be of equal size or slightly smaller or larger. It has got a granular cytoplasm, primary granules, and there can be one or two nucleoli in the nucleus. This is the only cell that has got both nucleolus as well as granules. And from now onwards, it becomes the secondary granule, myelocyte, metamyelocyte, neutrophil or the band form, and then the mature form. All these have got the granules. So it becomes smaller, there will be an indentation, deep indentation, and then segmentation or lobulation. This is the normal maturation. Please have it in mind. Now, this is something different which we do not find in the peripheral smear. So there will be some cells such as the myeloblast. All these are bone marrow cells, promyelocyte, the stab form, mature neutrophil, etc. Myelocyte, metamyelocyte. They are all cells that we people should remember. I would advise you people to kindly repeatedly see the picture and read this description. The normal differential count, all of you are thorough with. I need not go into it. But the bone marrow cells kindly become familiar. This is the classification of leukemias. There is a classification called the French, American, British. So this is important for us. And under that, there will be different types. Students have a tendency to simply write M1 to M7, like bus routes. That is not correct. M0 means it is again, as per the classification, minimally differentiated. So I cannot say what it is. There will be undifferentiated blast. Undifferentiated means not developing into a particular type of cell. M1, acute myelocytic leukemia without maturation. Here the myeloblast will predominate and distinct nucleoli will be seen. There are few granules or R.A.T.S are also few. Less than 10% of the cells will be mature. The next one, M2, will be acute myelocytic leukemia with maturation. Without maturation, with maturation. Here the myeloblast, promyelocytes. With maturation means the next cell will be there. Therefore, the promyelocytes will predominate. There are lot of cells with R.A.T.S, myeloblasts are there, and mature granulocytes. Third one is M3 leukemia or acute promyelocytic leukemia. It is hypergranular, and as the name denotes, lot of promyelocytes. They got many R.A.T.s. Sometimes they can be in bundles, and the cells are called as faggots. Rarely there is a variant called as hypogranular. M4, myelomonocytic. So, sequentially, there is a myeloblast, myelocytic without maturation, promyelocytic, then myelomonocytic. You find that both myelocytes and monocytes will be there. Otherwise, it resembles the M. Acute monocytic leukemia, there will be cells resembling the monocytes. There are two types over here, M5A and M5B. These are the two types. Non-specific S trace is positive. I'll show you the special states. Erythroleukemia, there will be the erythroblast that is there, more than 50% of the cells. Myeloblast also can be present. And the last one, M7, is acute megakaryocytic leukemia. Pleomorphic undifferentiated blast, and they will be having antiplatelet antibodies. That is why we call it as acute megakaryocytic leukemia. And purposely I have, what to say, camouflage this particular area. Let us see what I have got in the next slide. See in this, now it is released for us. Leave alone the classification, you people know this. I would like you to concentrate on the last column alone. So whenever there is a myeloid series, myeloblast, promyelocyte, etc., myeloperoxidase or Sudan black will be positive. Myeloperoxidase, 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 myeloperoxidase. So it is positive. And here it is myelomonocytic. Again, myeloperoxidase will be positive. And for the monocytic series, non-specific esterase is important. So it is positive in myelomonocytic as well as the monocytic. Erythroleukemia, PAS will be positive for the erythroblast. And acute megakaryocytic leukemia, platelet peroxidase. Megakaryocyte is equal to the platelet and platelet peroxidase. This will be the classification that I would like you people to remember. And I have completed the introduction of leukemia. Class 19 is over. Thank you.